One form of what is customarily known as stem cell therapy is adipose-derived mesenchymal cell therapy. Now you'll notice that that did not contain the word stem cell. We don't want this to be confused with stem cell therapy like being taken from embryos and from embryonic tissue. Adipose-derived mesenchymal cell therapy is taken from your own fat. I like to use the joke that I don't think of myself as being overweight. I think of myself as being a greater mesenchymal cell storage house. As long as you think of yourself as a reservoir that way, then you know that we can use your fat. No kidding, right in the office we do liposuction, a little mini liposuction under local anesthesia. To get about 60 cc's of fat is usually the most we ever get. We emulsify that, which means break it down into very small particles. We're able to centrifuge that, and one of the layers in particular is very stem cell rich. They aren't technically the most pluripotent, which means the most potential of all the stem cells. They're called connective tissue mesenchymal cells. So from that point of view, it is kind of a stem cell, and that's where it gets the name. But the mesenchymal cells can only become connective tissue. Well, that's okay. This is orthopedic surgery. We only want connective tissue. So we would take those mesenchymal stem cells from your fat, inject those into, for instance, an arthritic joint. There are many other applications. And they would stimulate that with the platelets from platelet-rich plasma to make the stem cells do what they're going to do, which is become the local tissue, and hopefully proliferate, which means to grow and develop either new tissue structures or at least repair the ones that are there. It's about 80% successful at helping people with arthritic knees, a little less successful in the hip, just as successful in the shoulder. We don't have nearly as much experience in the elbow, wrist, or ankle, though the literature supports it works there as well. I hope this was educational for you. I appreciate your time with us today. I am Dr. Ron Gardner with Gardner Orthopedics.